This is Pet Life Radio. Let's talk pets.
It's Oh Behave with Arden Moore, the show that teaches you how to have harmony in the household with your pets. Join Arden as she travels coast to coast to help millions better understand why cats and dogs do what they do. Get the latest scoop on famous faces, their perfectly pampered pets, and who's walking who in Rin Tin Tinseltown. From famous pet experts and best-selling authors to television and movie stars, you'll get the latest buzz from wagging tongues and tails, garner great pet tips, and have a doggone fur-flying fun time. So get ready for the pause and applause as we unleash your Oh Behave host, America's pet edutainer, Arden Moore.
Welcome to the Oh Behave show on Pet Life Radio. I'm your host, Arden Moore. You love your dog. You love your cat. I mean, you try to give them the most nutritious food. I bet you try everything you can to give them an enriched life. But do you know what to do when a pet emergency arises? Fortunately, help is here today on our show because our special guest is a real life saver, and he's going to give us the ABCs on performing CPR and much more. Please welcome to the show from Cornell University School of Veterinary Medicine. He's got a lot of Anna White initials after his name. He is Dr. Dan Fletcher. Welcome, Dr. Dan.
Thank you, Arden. It's great to be here.
Hey, Dan is the man when it comes to helping us learn what to do and what not to do to help our pet in a pet emergency. We're going to find out more, but we got to take a quick break. And you all know the drill. We're going to sit, stay. We'll be right back.
Time for a pause. 4 furry ones, actually. Sit and stay. Oh Behave will be right back.
Pause up, pet pals. Arden Moore here, your host of the Oh Behave show. Me? Wow. Did you know there's up to 100 million free roaming cats in the United States? And without spay or neuter, that number is only going to keep growing. Not only does spay neuter humanely reduce the community cat population, it keeps cats healthy. Scooter, the neuter cat, is on a mission to give cats an extra life by making it hip to be snipped. Hey, check them out. Go to GiveThem10.org. That's GiveThem10.org and help us make this a better world for cats.
Let's Talk Pets on PetLifeRadio.com. Oh Behave is back with more tail-wagging ways to achieve harmony in the household with your pets. Now back to your fetching host, America's pet edutainer, Arden Moore.
Welcome back to the Oh Behave show on Pet Life Radio. I'm your host, Arden Moore. I have one of my personal heroes on the show today. He doesn't even know it. I hope he's starting to blush. Dr. Dan Fletcher is an associate professor of emergency and critical care medicine at Cornell University in Ithaca, New York. Okay, take another breath. Ready? Listen to these initials. PhD, DBM, DACVECC. That's how we spell a very, very talented man. Dr. Dan, what got you even into veterinary medicine? Because looking at your background, you got some degrees, a PhD in, is it bioengineering?
Bioengineering.
Yeah, that's an easy one. That was a cakewalk, right?
My parents are very excited I finally have a job. So yeah, I had a bit of a meandering path to get here. So yeah, I started out in engineering. I was my bachelor's was in electrical and computer engineering from Drexel University in Philadelphia. I had no idea what I wanted to be when I was a kid, and my guidance counselor said, "You're really good in math and science, so you should probably be an engineer." And I said, "Okay, that sounds good, so I'll do that." So I got my bachelor's, and pretty early on, I realized I really liked the biology side of things and the medicine side of things, and so I started working in a lab at Drexel in biomedical engineering, and then wound up applying to graduate programs there, and then wound up out in California at UC Berkeley, UC San Francisco, joint program in bioengineering, did a bioengineering PhD. Really, really enjoyed it. Loved what I did. But when I was my second year of grad school, I started volunteering at a magical place in Sausalito, California called the Marine Mammal Center, which is a rehab facility for seals and sea lions that strand on the California coast. And that was my first opportunity to actually work with vets and to work in a clinical setting. And I fell in love with it. So I worked the Wednesday night shift, and I had a lot less gray hair back then. I became the youngest shift supervisor. I did. I earned every one of these. Became the youngest shift supervisor there, and just adored it. So I would work all day, and then I would go and spend the whole night at the Marine Mammal Center, and I would feel so energized when I would leave, and I would drink some coffee, and then I would go to work again the next day, and did that for about 8 years. Loved it. Absolutely loved it. Did a postdoc after I finished my PhD, and then was starting to apply for faculty positions in engineering. And it occurred to me that although I liked what I did, and I would say I loved what I did, I didn't have a passion for what I did. But what I had a passion for was medicine, clinical medicine, veterinary medicine especially. And and then I decided I was going to go for it. So I had to take a few more classes to get ready, applied to med school, and was very lucky to get into UC Davis.
And wait a minute, everybody, just a little pause. UC Davis is one of the renowned veterinary schools in our country. And how old were you when you got your DVM?
I was 32 when I finished vet school, so a little bit on the older side. It was nice to actually, I think it really helped me appreciate it more. I think some of my classmates sort of went straight through from undergrad to into vet school and didn't really have a lot of life experience and weren't 100% sure what they wanted to do. For me, it was my passion, and I was so excited to be there. So I didn't get the best grades, but I had the best time and had great experience and loved it. And then ultimately wound up at the University of Pennsylvania, where I fell in love with emergency and critical care medicine, where I did my internship, and then stayed there for my residency. And then I came here to Cornell in 2006 and have been here ever since. I started the ECC program here. It's been a great ride. I feel very, very lucky.
And all right. ECC, listen to the talk. He's Mr. Alphabet Soup, guys. Emergency and critical care. But what is it about? There's different types of specialties in veterinary medicine. To be board certified in emergency and critical care, that's a big deal. Why that? Why not internal medicine? Why not dermatology?
Yeah, I think at the end of the day, I have a short attention span. And I'm a little bit of an adrenaline junkie. Exactly. So when I started my internship at Penn, I had decided I wanted to be a neurologist, and that kind of fit with what I did my PhD work on. And I really did enjoy my time working in neurology at Davis. But when I got to Penn, I realized that in the emergency room and in the ICU, you get to treat all different types of patients, and you don't know what's coming in, right? I think in most other specialties, you have an appointment, you have a history, you know sort of what they're coming in for. In emergency and critical care medicine, you have no idea what's coming through the door, and you have to, there are a lot of puzzles that come in rapid succession, and I love it. I just really enjoy that aspect of taking an animal. I tell my students all the time, when an animal comes into the emergency room, it really comes down to, does he need fluids or does he need Lasix? That's the only decision you have to make initially. And the challenge is figuring out which of those, because they're kind of do the opposite things. And then, once you start your treatment, you reassess. And it's just, I don't know, like watching an animal come in, laying on his side, minimally responsive, and you give a little bit of fluid into his vein and he perks up and he starts wagging his tail and he licks you on the face. Like there's no better feeling in the world, right? It's just the best ever. So love it.
And what's the LASIK aspect? What would be the time where you would do that?
So Lasix is for heart failure. So if they come in and they look really bad as well, they're laying on their sides, they're not breathing very well, but it's a heart problem, then they need Lasix, which is the diuretic. So that's take fluid away, because animals who come in that kind of shape because of heart failure have too much fluid on board. So it's either they need more fluid or they need to take some of that fluid away. That's kind of the initial decision you have to make. So, and then after that, you have lots of different directions things can go. But I think that initial taking a patient on the brink and being able to pull them back is just such an amazing experience. So I wouldn't trade it for the world.
I wish we lived closer. Seriously, I'm in Dallas, you're in New York, but what you do save lives, and you help people learn how to save lives. And I think I saw a Metropolitan Life survey, and only about 2% of people have ever actually taken a veterinary approved pet first aid course. What can we do to change those numbers, Dr. Dan?
Yeah, I think it's so important. I think that what we know for sure, when there's a really sudden change in a patient status, an animal status, when they have something very sudden happen, like they choke or they collapse because of a heart arrhythmia, or they have some trauma and they have an injury and they're bleeding.
Right.
Seconds count in those cases. And I think knowing how to manage those things that you can, I think at the end of the day, I think the most important thing for pet owners to remember is learning first aid and maybe learning CPR to know how to sort of start to take care of a pet is really important. But really importantly is knowing where's your closest emergency vet that's open 24 hours. How can you get there? You have to know the directions to get there. Really knowing how to get to a vet, because what we can teach the pet owner is how to sort of buy some time and try to start to get that pet stable. But it's really important that they get to a vet really quickly and as soon as possible to get that definitive care. So yeah, I think there's a lot we can do. And it's, I'm sure we're going to talk about this project that we've been working on, but I'm really excited. We've just published the CPR guidelines, but I'm excited that we also had a whole domain on first aid that we're working on finishing up. And that'll be published soon. And it'll be our first, evidence-based first aid guidelines as well, which I'm really excited about.
And I think the definition of pet first aid to me is the life-saving bridge between the and the veterinary clinic. I think the role is to, on the scene, and stabilize and transport to the vet. And there's this thing on our phones, Dr. Dan, it's called a speaker. And I think as a veterinarian, don't you appreciate someone calling the veterinary clinic ahead of time en route, telling you that they have a pretty bad situation with the dog or cat?
100%, so that the team can be ready as soon as you arrive to come up and grab your pet, bring them in, and get started on things. So yeah, 100%, I think. And that's why I think on your phone, having the phone with the speaker is great. Having the phone with the speaker programmed with the closest emergency vet's phone number and your local vet. So if it's during the day, by all means, your local vet can manage a lot of these things. But I think also making sure that you know where the closest 24-hour emergency facility is and having that programmed to your phone is really critical.
Hey, everybody. We're speaking with Dr. Dan Fletcher. He's from Cornell University, and he also wears many collars in the world of pets. He is one of the co-chairs of a program called Recover, and it is revolutionizing, updating, changing, modernizing the way that CPR is given to a dog and cat and other things with pet first aid. We're going to dive into that after we take this break. Sit, stay. We'll be right back.
Time for a walk on the red carpet, of course. All Behave will be back in a flash right after these messages.
Ready for the biggest cat celebration in the world? Come to the CFA International Cat Show and Expo in Cleveland, Ohio on October 12th and 13th. The expo is the world's grandest cat celebration, seamlessly blending pedigree cat exhibitions with feline welfare and rescue initiatives. It captivates over 10,000 feline enthusiasts each year, celebrating all cats, whether rescue or pedigreed, in a shared spirit of love and unity. Dive into cat-themed activations and enlightening educational sessions. Marvel at 1,000 non-pedigree and pedigreed cats, adoptable felines, and explore over 100 cat-themed vendors. It's an event dedicated to honoring our beloved felines and their admirers. And guess what feline influencers are coming to meet and greet? YouTube cat video sensation Aaron's Animals, as well as Nathan the Cat Lady, Lambo Leisha, Choopy, and many, many more. Gather your cat crew and do whatever it takes to head to the CFA Cat Expo. It's a whisker-wiggling, tail-twirling extravaganza you won't want to miss. Get your tickets at CFACatExpo.com. That's CFACatExpo.com.
Pet Greens is proud to support Oh Behave on Pet Life Radio. Our small family farm produces live organic cat grass, catnip, and soft chew treats packed with green nutrition to help your pets truly thrive inside. We're partnering with pioneer cat behavior expert and best-selling author Pam Johnson-Bennett to help indoor cats live their best lives with indoor enrichment tips for their parents.
I'm very careful about the products that I choose because I have built a reputation over 4 decades where cat parents trust me and they know that when I recommend a brand or talk about a particular product, they know it came from my heart and I really believe it. I've done my research with Pet Greens. I love the products. I love the quality. And one of the things that I feel just stands out is the education that Pet Greens provides. They guide you every step of the way. It's a relationship. I know how much they love cats and how much they love cat welfare and cat health, and that's their motivation.
For more information on the benefits of cat grass and catnip for your cat's indoor enrichment, visit petgreens.com.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Hey, this is Catherine Heigl, and you are listening to Miss Arden Moore on O Behave on Pet Life Radio. Tune in for more fantastic ideas and tips for your dogs and cats and pets.
We're back from the lot. Just checked the paper and we had a record showing at the box. The letterbox, that is. Now back to O Behave. Here's Arden.
Welcome back to the O Behave Show on Pet Life Radio. I'm your host, Arden Moore, and we have on our show Dr. Dan Fletcher. He is an emergency and critical care veterinary associate professor at the University of Cornell. Boy, if you're on an elevator ride, man, you can't get everything you do on that 10-second ride, can you?
I don't know about that. It took a long time to get here, but what I do is not that complicated.
But folks, this is a big deal. I got some news release from Cornell, and the way we do cardiopulmonary resuscitation on a dog or a cat, it keeps evolving, just like in human medicine. And so, Dr. Dan, try to help explain what's going on, because I want to make sure we get you got two other co-chairs. Do you want to give a shout out to your colleagues?
Yeah, so this is a collaborative initiative, the Reassessment Campaign on Veterinary Resuscitation, or Recover Initiative. It was a joint program of the American College of Veterinary Emergency and Critical Care. That's the specialty board that I'm boarded through, and the Veterinary Emergency and Critical Care Society, which is a large international organization dedicated to veterinarians and veterinary technicians who are interested in emergency and critical care medicine. So we started the Recover Initiative back in 2010, and it was me and one collaborator, Manu Bowler, who at the time was working in a resuscitation lab at the University of Pennsylvania. We were resident mates, so he's a veterinarian, but he had then gone on to do some research in CPR because it was an area he was very interested in. So when I started my position here at Cornell, one of the things I was really interested in was developing sort of standardized CPR training for veterinarians and veterinary nurses, because nothing like that existed. And so I contacted him because it was...
Wait a minute, let's take a pause on that. Can you believe in 2010, we still had not standardized how to do CPR on a dog or cat? Thank you both for thinking of doing that.
Yeah. No, it's everyone sort of took the human guidelines, adapted them, did what they thought they should do with them, but nobody had really looked at the evidence primarily through the lens of dogs and cats. So I reached out to him because I wanted to put a course together, and he said, I would love to put a course together with you, but the problem is we don't really know how to do CPR on dogs and cats, right? Nobody's ever really looked at this. And so that's what launched this. And so he had some connections in the human resuscitation community, and we were very, very lucky that we had amazing support from some collaborators from the International Liaison Committee on Resuscitation, or ILCOR. That's the international organization that really does the groundwork of trying to develop CPR guidelines in people. And then ultimately they feed that information to places like the American Heart Association here in the US that runs courses, and the American Red Cross, and then also organizations around the world. So we worked with them to try to develop a process to do this. And it was fantastic. We couldn't have done it without their help. So we did our first round back in 2010 to 2011, published in 2012, where we actually picked specific questions about how to do CPR. We did an evidence review for every one of those questions, looked up at all the literature, both in human medicine and veterinary medicine, to try to answer those questions. And then from those answers to those questions, we were able to write the first Recover guidelines. And so those had been in place. It took a little while for people to figure out what we were doing. It took a few years before they really started to take off. And then we ultimately got to my dream, which was to get standardized training in place. So we developed online courses and an in-person certification process. And to date, since 2013, when those launched, we have about 95,000 veterinarians and veterinary technicians who have taken the online course, and over 20,000 who have done the in-person rescuer training. So we're really proud that we've gotten this word out and that people have really bought into it.
Yeah, let's bring it home real simple. I'm talking real simple. As you know, Dr. Dan, I'm a master instructor in pet first aid and CPR. My own company is called Pet First Aid for You. I am so blessed to have pet safety dog Kona and pet safety cat Casey as my teammates. But I work with a lot of ER and critical care veterinarians that help me help others. So my role is to help people and pet professionals, not the vets, not the, your area. But the point is, We do CPR because of CPA. Can you explain that?
Yeah. So cardiopulmonary arrest is the sudden onset, or CPA, of an animal stopping breathing and the heart stopping. And we think in dogs and cats, most commonly they stop breathing first and then the heart stops. Although occasionally some dogs, especially dogs who tend to have heart diseases that cause arrhythmias, like boxers and Doberman pinchers and those kinds of dogs, they'll occasionally have a primary cardiac arrest when the heart stops first. Either way, very quickly, the other will stop once you stop with one of those. And so really starting CPR immediately is the only way to buy enough time to get to the vet to try to reverse that. So I think a couple of things about cardiopulmonary arrest that are really important. So some animals experience cardiopulmonary arrest. So that's a sudden or an acute onset of some problem that causes them to stop breathing or the heart to stop. So that could be a heart problem. That could be choking or an airway obstruction where they just can't get oxygen anymore.
The avocado has completely sealed the airway. Avocado pit,
yeah. Exactly. Or a ball, or like a chew toy or something like that. Yeah. So those are the kinds of things that it's very sudden, and if we act quickly, we can reverse that and get them back and hopefully have them going to have a good quality of life. There are, however, some cases where I would argue an animal doesn't have an arrest, but an animal actually passes away, right? And so CPR is not something that I would recommend people try at home for, say, an older dog or cat who has many concurrent health issues, and maybe these have sort of added up to cause that pet to pass away. It's not a miracle, right? It's not gonna reverse a disease. And so when I think about the benefit of CPR, it's really for that patient who has a very sudden problem that caused the arrest, and that we can hopefully support them long enough to get that reversed. And sometimes that means you have to get to the vet to get the primary condition reversed. But if we can start, the CPR can help.
Oh, absolutely. Is the statistic accurate that every minute the heart stops, the chance of survivability goes down 10%?
Yeah, so in people, that's true for sure. We don't have good data in dogs and cats about that, but I would suggest that it's about the same. But yes, certainly we know that minutes, actually seconds, count in this case. And that's why I think knowing how to do the basics of CPR can be really life-saving in these patients, knowing how to, do a quick airway exam to see is there something in there that's obstructing the airway that you can remove. Those are the kinds of things that I think a pet owner can do that could potentially be the difference between turning that around and not.
And is the formula the same? 30 chest compressions, 2 rescue breaths, 30 chest compressions, 2 rescue breaths?
Yeah, exactly. So we've...
And then assess?
Right, yeah. So we've developed an initial algorithm to get started. And really, it's not complicated. So if a pet is unresponsive, the first thing we recommend is that you stimulate them. So this cat is unresponsive. I'm going to shake him.
Hang on. For those on my YouTube, they get to see him. Go for it, man. Go for it.
Yeah.
Okay.
So if this cat is unresponsive, I'm going to stimulate and call and see if I can get him to respond. If he doesn't respond, then the only thing I'm going to do before I start CPR is to see if he's breathing. So I'm going to look at his chest and see if there's a chest rise. If there's no chest rise, if there's no sign that this patient is breathing and I can't stimulate him, then I'm going to move on to start CPR. If I have someone else with me, I'll start chest compressions right away, and that other person I will ask to check the airway. And so what they're going to do is open the mouth, pull out the tongue.
Well, if you wouldn't mind, just do a whole set right now. Just go for it. I want to
Sure.
Just go 10, 20, 30.
Do the compressions?
Yeah.
Yeah, sure. So they're going to be checking that airway while I start chest compressions. So the chest compressions in a cat or a small dog, we generally recommend single-handed approach. So there are 3 new techniques. So one of the things that's changed in the new guidelines is that we have 3 techniques for cats and small dogs. So one is this one-hand technique where you wrap your hand around the chest like this, and you're going to bring your thumb against your hand like this to try to milk blood out of the heart.
You're kind of a lobster claw.
Yeah, it's like a lobster claw. So what you're going to think you're supposed to do is pinch your fingers together, right? That doesn't work because I have a prop here. So this is what a heart looks like. So this is kind of the size of a heart, and a little big for a cat, actually. And so if I put the heart in my hand and I squeeze my fingers together, I'm actually squeezing up here at the base of the heart. This is not the ventricle where the blood is. So what I want to do is I want to bring that thumb against my hand like this. That allows me to milk the blood out of the ventricle, which is the part that's holding that blood, and move it out to both the lungs and to the rest of the body. So we're going to bring our hand in like this. So this can be pretty tiring. And if you don't go to the gym and do a lot of forearm exercises, you're probably going to get tired pretty quickly. So there are 2 other options that we can use. The next one is what we call circumferential chest compression. So the idea here is with the cat or dog laying on its side, I'm going to wrap both hands around the chest and I'm going to put my two thumbs together right over the location of the heart, and I'm going to squeeze both fingers at the same time. So I'm doing the compressions with my thumbs like this. And that way you're using two hands to do the compression instead of one, and hopefully you won't get quite as tired. If the small cat or the dog is too large to get your hands around the chest like this, the third approach you can use is what we call the one-hand technique. So with this, I'm going to put my non-dominant hand along the spine, and I'm going to take my dominant hand, the heel of that hand, I'm going to put it right over the heart, and I'm going to do my compressions like this. So I'm going to use my whole arm to do the compression. So I can get it's a little less tiring to do it this way, because rather than just using a hand, you're using your whole arm. So those are the three approaches that we recommend in cats and small dogs less than about 15 pounds or so.
And let's stop because I want to review, because you just showed three different hand movements. Thank you. And you're trying to get that heart pumping again, to get the oxygenated blood to all the vital organs and all that. That's a game changer, isn't it?
Yeah, it's the most important part of CPR. So really getting those chest compressions going immediately is so critical. So you can use any of those three approaches in cats and small dogs. And
what about the breathing? What about the breathing? You're going your breath into the nose?
Yeah. So the breathing, so we can finish up with the breathing for sure. So what we would recommend if you're out in the wild and you have a patient that you're doing CPR on would be what we call mouth to nose breaths. So to do a mouth to nose breath, we're going to blow in through the pet's nose. So we have to make sure that air is going to go into the lungs and not out the mouth or somewhere else. So first step is we're going to close the mouth, make sure we close it very tightly. Second step is that we want to tilt the head back so that the nose and the spine make a straight line. And that's what opens up the trachea, the windpipe, if we make a nice straight line. If the head is tilted down or back, or if you lift the head up off the ground, you're going to sort of kink the trachea, and less air is going to go into the lungs, more but will go into the stomach, basically. So we want that neck nice and straight. We want to close that mouth, and then we're going to get two very quick breaths. Make a seal over the nostrils, and we're going to get two very quick breaths. So like that, and then we'll go immediately back to those chest compressions, and we'll do that 30 to 2. So 30 compressions, count them out loud, and then when you get to the 30th compression, you get two quick breaths, and then you immediately go back to those chest compressions again. And you keep doing that until somebody comes, hopefully with a car, and then you get in that car and you start driving to the vet. And you can do this while you're traveling.
Now, you don't open the airway and get the tongue out of the way, do any finger sweeps anymore?
Not typically, because again, we're going through the nose and back. So as long as we get that nose lined up with the spine, we should be opening up the airway from the nasopharynx, which is that part back here, and back. We don't typically have to worry too much about the tongue. It's usually not going to be in the way. Now, having said that, we did kind of skip over that airway assessment a little bit. So before we start that, we would want to check the airway and make sure it's clear. So we will open the mouth and we'll pull the tongue out as far as we can and look all the way back. And you should be able to see back to the tonsils, and you should see the arytenoids, which are these two little guys that stick up that can bounce back and forth a little bit. Hopefully you can see all the way back there. And as long as there's nothing obstructing, then you just go on and do the breathing. If you pull that tongue out and you look back there and you see something back there, there's a ball or there's fluid or something like that, then you want to do a finger sweep to try to get that out of there. So it's very important to be very careful with this, because if there's an object back there that's kind of small and you just kind of poke it, you could push it back further into the airway where you can't get it. So I would be thinking about, if I see something, I'm going to put my finger in the side of the mouth and I'm going to sweep to the side to try to dislodge it and knock it out, as opposed to pushing it back into the airway. So really important that you avoid that.
Show us for a larger dog.
Absolutely.
You're going to do that one.
So then for a larger dog, like this guy here, we are going to do chest. It doesn't matter which side they're laying on. Either side is fine.
Oh, can I give you a rhyme that I teach?
Yeah.
Because dogs and cats have teeth and claws and they don't speak English. We do belly to back like you are, because we don't want to grab. But I say the hand that does the pump is closest to the rump.
The hand that does the pump is closest to the rump.
And because this way, if there's a startled response, you can go down with your forearm against the head.
Got it, to keep them from bouncing up.
What do you think of my rhyme?
Yeah, I think that's good. Yeah. So that way, this up arm you're saying is sort of facing that way. Yeah, that's good if they do jump up, for sure.
Okay, so go for it, Dr. Dan.
Yeah, so for medium and large breed dogs, they have two different chest shapes, and we have to figure out in each patient which one they have. Well, three different. We'll talk about the third in a second. So this dog has what we call a round-chested conformation. So if I run
like
my hand,
beagle.
Yeah, like a Beagle, Labrador, most of them will have this shape. Within a breed, you can have some variation. So I would encourage you to assess each patient. But the way I figure out if a dog is round chested is with them laying on their sides. I run my hand over the chest, front to back and bottom to top. And if I do that and I feel a dome in the middle of the chest, if it feels like a sphere and there's a dome poking up at me, that's probably a round chested dog. And in that case, I'm going to do my compressions directly over the highest point on the chest. So I'll take my my hand that I'm going to have touching, and I like that. The dominant hand, the hand on the chest is toward the rump. And I'm going to make sure the heel of that hand is over the highest point on the chest. That's where I'm going to focus my compression. I'm going to put my other hand above it and interlock those fingers. And I'm going to make sure my elbows are locked, and I'm going to bend at the waist to achieve my compressions like this. So you're going to have a tendency to want to do compressions by doing this. Now, you guys all out there probably do go to the gym more often than I do, but it doesn't really matter how often you go to the gym. Your core muscles are always going to be stronger than your biceps and triceps. So you want to keep those elbows locked and do the compression by bending at the waist. The easiest way to do this when you're at home is to make sure that your pet is on the floor and just kneel behind them on the floor. So you're kneeling right up against the spine, and you're going to get yourself in that position. And you just want to make sure that you're up and over and those shoulders are directly above the hands.
I like that.
Making a straight line down the chest. So that's really important in terms of posture.
And what's the other hand positions based on different chest dimensions?
So there are two other possibilities. So one is that this is what we call a keel-chested dog. So like the keel of a ship where it comes to a triangle. And the way I would determine that, and this cat is a little bit more like that.
That's like an Afghan, right?
Yeah, like an
Borzoi.
Afghan, a Borzoi, a Greyhound. And so if I run my hand from the bottom of the chest to the top of the chest, and my hand just kind of goes up, and then drops off. And if I go front to back, if I'm at a particular location, if it just stays sort of at the same elevation when I go front to back, it doesn't go up or down, I don't get that dome feeling. That's probably more the keel-chested dog. And in that case, I'm going to focus the compression right over the heart, just like I would in a cat or a small dog. And to figure out that location, if you take the front leg and you bend the elbow and rotate the arm up along the chest wall, you just rotate until the elbow is about a third of the way up the chest. So think about the bottom of the chest to the top of the chest, come 1/3 of the way up, rotating that arm. That elbow will be pointing pretty much right over the location of the ventricles of the heart. So that's where we're going to focus our compressions there, right over that location. So it's going to be a little lower and a little further to the front of the patient that we're going to be doing our compressions in this case. So heel-chested dogs right over the heart.
And tell people, I think they used to go down 1/3 to 1/2, but you say now 1/4?
So that's only in certain cases. So the third type of dog, so for these guys, for cats and small dogs like this guy, and medium to large breed dogs that I'm doing compressions on their sides, we go 1/3 to 1/2 the depth of the chest. That's what we're focusing for. And it's really hard when you're the one doing compressions, if you're doing this two-handed approach like this, to know how deeply you're going. So ask the other people who are with you to look and tell you how deep you're going. So you don't want to go any less than 1/3, but you don't want to go any more than 1/2 that width because you could overcompress and injure the heart. So the third type of dog is this monstrosity here, right? So this guy is a little bit shaped a little bit more like us. We call these wide-chested dogs. So they're more wide than they are deep. And if you cut them in cross-section, they make kind of an oval. And so they're shaped like us. And so in these patients, we actually do say you can put them up on their backs like this.
Well, aren't it because their shoulders are wider that they can actually sleep like this real easy?
Yeah. And so in general with these dogs, so English bulldogs, pugs, French bulldogs, a lot of them have this type of conformation. And I would say the general approach I take is if they have that conformation, then I'll put them on their backs. And if they stay on their backs without me touching them, they probably are shaped this way. If I put them on their backs and they keep rolling over onto their sides, they're probably more likely round-chested, and I would do it that way. But if they stay that way, and you guys have probably all seen videos or have bulldogs who can't get off their backs. They look like turtles when they get back there. Those are the perfect ones for that. So for these guys, we're going to focus our compressions right over the heart again. So same basic idea. Pull that elbow 1/3 of the way up the chest here. That location is where I'm going to then come across to the middle of the chest, and I'm going to focus my compressions right at that location on the chest. And I'm going to do the compressions this way on the patient, sort of like you would in a person, right over the breastbone, right? We're going to focus the same place. In this case, we only want to go 1/4 the depth of the chest. because these guys have a whole lot of tissue up here in the spine that takes up space. And so if you go that half that depth, you're going to be probably over compressing the heart. So in this case, we're trying to squeeze the heart between the sternum, the breastbone, and the spine. And we just want to go a little bit less deep because of that extra tissue that's in our way when we're doing that compression that won't compress. So those are the 3 different ways. Yeah.
So once you do the chest compressions, do you then roll them to their side to do the rescue breaths?
Yeah, it's probably best to roll them to the side to straighten things up. Otherwise, it's going to, especially with a bulldog, because you guys, anybody who's ever experienced them knows they have so much tissue back here. So yeah, it'll be better to roll them on their sides. Same thing, straighten that snout as much as you can, close the mouth, and blow right into the nose for those 2 rescue breaths.
So in summary, everybody, I want people to go check out the Recover program, because we want people to know how to save a pet's life and how to do it right, CPR. Dr. Dan Fletcher, how do people find out about how to do this?
Yeah, so our website is recoverinitiative, all one word, .org, or you can just search for Recover Vet and you'll find it. And we have a bunch of information on our website about it. We have online courses. There is an online pet owner course you can take to get some of the basics. I do think that going to a lab with someone like Arden is a really, really important next step, because learning in theory how to do these things is one thing, but learning how to actually do these physical skills and get feedback on them is so critical. And we know that from human medicine, how important it is to have those skills labs. So I think, you could take the online course. It takes about an hour. You can get the basics there, and then you could go to a lab with someone like Arden to learn how to do those hand skills. And there's just a lot of information up there about that.
Well, I'm blessed because I team up with ER and critical care veterinarians, and they have helped me. My mission is to give out veterinary approved information, but I've actually done CPR 4 times. I've saved 2.
Wow, that's amazing. That's really great. And I think the other
blessed.
thing, I think the other thing that pet owners can do is just, talk to your vets about whether they had CPR training, whether they're aware of Recover or not. This all started out of the emergency and critical care community. And when I go to emergency and critical care conferences, like our International Veterinary Emergency and Critical Care Society meeting, I'm basically preaching to the converted. People know about it. They're excited about it. They're excited to have guidelines. I think that in veterinary medicine, there's been sort of a history or a suspicion, I guess. People didn't know how to do CPR. They were afraid to try to do it. So they would do it not very well. They would rarely get any patients back. And so they kind of gave up on it. And so there are, unfortunately, still among especially the gray-haired vets like me, sort of this feeling that CPR is futile and that it's not worth trying. What we know from the literature and even from our own data in veterinary medicine now, we're just starting to collect, is that especially in these very sudden reversible cases, and the classic would be you take, your local vet sees the patient who is coming in for a spay, a routine surgery that they do all the time, and they have a weird reaction to the anesthesia and they arrest under that anesthetic agent. Even before we had guidelines, about 50%, if we started CPR right away, about 50% of those patients would survive to discharge and would do fine if we started CPR right away. The most recent data that we have from UC Davis about these arrests that happen around the time of anesthesia is that pets that arrest in that peri-anesthetic period are 15 times more likely to survive to discharge. And so a lot of the studies that we have that give us this data are from places like where I work. I work at what we call a tertiary referral facility. So we're not only the first referral, we're usually the second referral for someone who's taking their patient in and they have really complex problems. So we see the sickest of the sick here, and that's where a lot of our data come from. We have every reason to think that your vet in general practice could have really good success rates with CPR because they're mostly going to be dealing with acute sudden reactions to something like an anesthetic or a sedative. And we know that they can do really well. So I think that's another thing that I'm most excited about now is really trying to get this word out to veterinarians who are working in general practice as opposed to emergency people like me who kind of see the worst of the worst cases. And we get a lot of them back, but I think that our colleagues in general practice could get even more back. And I guess just one thing to, good. I was going to say just one thing to finish up with the Recover stuff is just the reason that we just sent out a press release is because we did do just a major update, and that's where these new approaches to chest compressions just came from. So that was just published June 24th. Or 26th. They just came out in the Journal of Veterinary Emergency and Critical Care. So we have a whole new set of guidelines. A lot of it's the same, but we do have some pretty significant updates, like the different approaches to chest compressions in small dogs and cats. So So yeah, getting the word out to your vets to maybe take a look at that is also a helpful thing.
Well, I appreciate you doing the demos because, folks, you're going to see it on my YouTube channel, polished and edited. But we're also going to have you back when you get into more pet first aid guidelines coming up. But we wanted to focus on CPR on this show. But you can't leave the show without doing a shout out to two of your special dogs. I've seen you guys on trails and camping and hiking. Come on, they're listening.
They are the best. So I have an Irish Wolfhound named Orla who turned 8 in April. So she's had a few health problems, but she's doing great. She's a happy girl. We just had a beautiful hike this morning before I came to work, and I'm very, very blessed to have her in my life. And then my St. Bernard Great Dane mix, Eleanor, who turns 11 next month. So I'm running a geriatric ward at home right now, who is a wonderful, wonderful dog. She's the sweetest. She is also a therapy dog, and she loves nothing more than to snuggle up with her friends. And then I also have to make a shout out to my kitty, Apple. He's a rescue. He was a barn cat who loved to go and visit the people who would come to see the horses at the barn when they came to feed him apples. So they started calling him Apple, and then he wound up in my house and is great with the big dogs. He loves them.
Is he an orange tabby?
He's an orange tabby. Yeah, he's a sweetheart. He's such a good boy, and he just loves his girls so much. They're thick as thieves, those three.
So I know I'm not a veterinarian. I don't play one on TV, but what do you think when we say that we're here to try to teach veterinary approved courses to people, pet professionals in the boarding, pet sitters, dog trainers, pet parents? I can't do my job without people like you.
No, I think it's so critical what you do. And I think a major difference between veterinary medicine and human medicine is we don't have ambulance services in most places, and we don't have EMTs who can get out there, right? And so unfortunately, that burden falls on the pet owner to figure out what they can do in the short term while they're transporting, unfortunately, the pet themselves to the veterinarian, right? And so I think getting this kind of information out for these very sudden problems is so important. And I think can make a difference. And I've had multiple cases that have made it to this hospital where the owner started CPR on the way, and we were able to turn those around. So I do think it can save lives, and I think it's just critical in the absence of those kinds of systems.
We definitely need to have you back, Dr. Dan Fletcher. Everybody, please check out the Recover Initiative. He is at Cornell University. He is my personal hero. And for the YouTubers, you get to see him do the demos right there. We appreciate that, Dr. Dan. I also at this time want to give a shout out to my producer, Mark Winter. He is the executive producer of Pet Life Radio. We're the largest radio network on the planet with dogs, cats, and others. Check out my YouTube. It's Arden Moore, God-given name. That's my real name. And we have an e-newsletter on four-legged life. You want to take a course that is approved by veterinarians? It is pet first aid for you, but take a course anywhere. I don't care. The more people that know how to do pet first aid and safely get the pet to the veterinary clinic makes Arden a happy person 100%. And makes Dr. Dan Fletcher a happy man, right?
You bet. And I think I love that you called out all these people who make a difference here and who make this possible. And I would be remiss to not also call out the fact that these guidelines were not something that there's a third coach here this time around, Jamie Burkett from UC Davis, who's amazing. And then we had a group of over 300 veterinarians and veterinary technicians who volunteered their time to review all of this literature. It was a huge number of questions. Over 1,200 individual studies were evaluated for these new guidelines, and we couldn't have done it without the hard work of the community. So it takes a village in all of our realms, and I think it's so important to remember these contributions from these people are just incredibly valuable.
I agree. So everybody, until next time, this is your flea-free host, Arden Moore, delivering just 2 words to all you 2, 3, and 4-leggers out there. Oh, behave.
Coast to coast and around the world, it's Oh Behave with Arden Moore. Find out why cats and dogs do the things they do, and get the latest buzz from wagging tongues and tails in Rin Tin Tinseltown. From famous pet experts and best-selling authors to television and movie stars, you'll get great tail-wagging pet tips and have a fur-flying fun time. All Behave with America's pet edutainer, Arden Moore. Every week on demand, only on PetLifeRadio.com.